Well, hi everyone, and greetings from Northern Michigan. This is Bob the Science Guy, and we've got something new for you tonight. I'm doing a presentation or a quasi-live stream. I've pre-recorded this to make sure that we don't have any technical issues with my bandwidth or the lack of RAM in my computers. This has been pre-recorded and uploaded to YouTube, so if you have any buffering, that's on you. Now, I am going to be present in the chat for this, and I will be interacting with the audience. However, the presentation that I'm doing right now is pre-recorded. Now, today what we're going to do is we're going to go over the problem of vaccine hesitancy. And this is an interview from VaxxTV of a vaccine hesitant mom. And what I'm going to do is I'm going to go over what she's saying and how the interviewers are treating her and leading her along. And I'm going to discuss some of the reasons that we have vaccine hesitancy and try and address them. Recent studies have shown that there are basically 4 reasons that people are vaccine hesitant. Number 1, religious reasons. Some religious groups, I guess, choose not to become vaccinated. And, well, that's a religious group. Number 2 is personal beliefs. And these personal beliefs include ideas about liberty, personal space, and ideas about natural health care. You know, natural things are somehow better than medicine. The third problem is basically concerns about safety of the vaccines. And in most cases, that comes from not understanding the risk to benefit ratio of the vaccines. And the third one is a desire to just know more information from their healthcare providers, and their healthcare providers are not giving it to them. Let's go ahead and roll this interview. This is a vaccine hesitant mom who was interviewed by VaxxTV within the last week or 10 days. And we're going to kind of go over everything, and then I'm going to interject as I feel necessary. So let's go ahead and get this started.
Okay, so your name?
I'm Sarah.
Sarah.
Yeah.
And how many children have you got?
I have 2.
2 children. How old are they?
My son is 7. My daughter's 5. Oh, just turned 5.
So your son is vaccinated and your daughter's unvaccinated. They're vaccine free.
That's right.
So you really have your own vax study.
Now, this is an interesting start to this interview. Notice how the interviewer is starting to inject herself into this conversation rather than simply asking questions. Now, the first big jump that she makes is this young lady has got 2 children. One is vaccinated and one is not. The interviewer immediately goes into saying, well, you have a vax and vaccine free, not unvaccinated, but vaccine free, kind of like free-range chickens aren't in cages, I guess. But she uses very specific terms to talk about unvaccinated, unprotected children. And she suggests that this is somehow a study with an N number of 2. That means that there are 2 people in the study. When you do a study, you have to have a certain critical number of people in order to have differences be significant between the 2 groups. A study of 2 is much more random than an actual medical study.
So, okay, when you were pregnant with your son, did you guys have a conversation about vaccines?
No. Oh my gosh, not at all. Conversation about everything else, but not that. I got the DTaP while I was pregnant, and I got really, really sick. I thought it was food poisoning, and it was right after Thanksgiving. I got sick on Thanksgiving, but nobody else got sick. It was just me. So we didn't talk about.
Did you get the flu vaccine as well?
No, not the flu. Because, you know, it's acceptable to not get the flu shot. Yeah. Right?
It's kind of cool not to get the flu
yeah.
shot.
No, they scared me into getting the DTaP because pertussis, your baby needs pertussis shot.
Now, again, this is kind of a novel approach. I was scared into getting vaccinations. People that got the polio vaccine in 1955 were not scared into getting vaccinations. They were scared of polio. It's very appropriate to be scared of pertussis in an infant. And it's very appropriate to want to be protected against having your baby develop pertussis. That's one of the reasons we vaccinate people. Now, the other thing that's kind of an interesting turn of a phrase that they use is it's somehow cool to refuse a flu shot. Why exactly is it cool to refuse a flu shot? Let's think about that for a while.
So I got that one. I got sick, but I have a spinal condition, so I had a home birth because I was terrified of having a hospital birth because I didn't want them to scare me into getting what is it called?
Epidural.
The epidural. Thanks.
Well, this young lady seems to think that medical care is driven by scaring patients. She's scared. They scared her into getting vaccinated when she was pregnant, and now she would rather have a home birth than have a birth in a hospital because she's afraid that they're going to scare her into getting an epidural. You know, if you don't want an epidural, that's fine. We won't give you an epidural. If you change your mind later on, we can give you the epidural. It's not a big deal. We don't benefit from you not having pain from childbirth. Now, as far as this condition of spina bifida, we recently had a study in Northern Ireland, Scotland, and England where they looked at 700,000 epidurals. And they had a panel of physicians review each of those cases. And in all the cases that had a complication, there were something like between 14 and 30 cases, depending on who you talk to, that had a complication. And of that, approximately 7 people had paralysis. Now, the paralysis was not necessarily from the needle. The paralysis could have been from the medication, the way the thing was administered. I looked at spina bifida occulta, which is what this young lady has. It is suggested that you be a little bit careful and maybe try and figure out where the spinal cord actually ends. But the spinal cord normally ends at L2, and an epidural is administered down at L3-4. So it's below the spinal cord in an area called the human horsetail. You can't damage the human horsetail with a needle. And the way an epidural is done is you don't even enter the spinal cavity itself. You go into you go above the dura. It's not even in where the nerves are. So this is a lack of education and a lack of asking the right questions and listening to the answers on the part of this young lady.
What's wrong with your spine?
I have spina bifida occulta, so the lower vertebrae are mostly cartilage and not all bone. So my spinal cord is intact, but the vertebrae, like the ligaments and everything, are different. So if I ever had a lumbar puncture or anything, it could paralyze me. Like,
were you born with that?
I was born with it, yeah. So the risks are much higher for me getting paralyzed versus a regular person getting paralyzed from an epidural, even though their risk is still there too. Actually,
that's categorically false. They have a very, very slight increase in risk with spinal taps, not epidurals necessarily, but spinal taps. And it's minuscule.
That's the only reason that I had a home birth, not because I was like crunchy or anything at the time.
Actually, I was quite clever though.
So, right? Yeah, my fear of doctors for that reason, for myself, not the fear of doctors for my child. But
so you have a home birth.
Yeah.
And what is a midwife or something come around?
And a midwife who went to Yale. So we lived like less than a quarter of a mile from the hospital. So we thought if anything goes wrong, our midwife is awesome and the hospital's right there, no big deal. And
did you have any pain medication?
Nothing.
You know, let's go ahead and have a look at this for just a second. You know, I'm glad she didn't have a lot of pain with childbirth, and that was wonderful. You know, good for her. I don't have any problem with home births for uncomplicated deliveries, and midwives are extraordinarily well trained and licensed. I find it ironic that she is so afraid of doctors and so hostile to medicine, yet she makes a point that the hospital was only a quarter of a mile away. She's quite happy to take advantage of medicine if she feels that she needs it, but she wants to make that decision. She doesn't want to be in the hospital in the first place. So if she has a hemorrhage or a problem with the birth, she would rather go through the emergency room, up to the obstetrics floor, and then into the neonatal ICU instead of directly to the neonatal ICU. To each their own.
I went full natural. I was eating chocolate while I was in labor. I mean, I was like really just did everything totally crunchy. I had watched those birthing documentaries and I kind of got empowered on that, but
Now here we kind of see the first of these 4 reasons that people are vaccine hesitant. Notice how she makes a big deal of the fact that she wanted to do this naturally, which meant, I guess, without artificial medicine or resuscitation or anything like that. The other thing is she felt empowered because she watched YouTube videos on this. And therefore, I guess that makes her an expert.
I don't think that they mentioned anything about vaccines. I never had any red flags raised about them. I didn't know. I didn't know anything about it. So my son, his first vaccine wasn't until he was 2 months old. And I was uneasy and hesitant. Our pediatrician just rushed us through it. I was so uncomfortable that I had to leave the room. And so my husband was there during the vaccination. I was outside. And when my husband was done, he brought my son out and he was asleep. He had never really slept that hard during the day. I called the pediatrician's office later that day asking them about it because my son wouldn't wake up, and they said, oh, he's just being good, sleeping through his shots. So he's a real champ.
Now, what an unfortunate scenario. This is another of the 4 reasons. Apparently, this woman was uneasy with vaccinations and felt rushed by her doctor to just have the kid get his shots. That could have been handled a lot better on the part of the medical profession. This is the time you sit down. If you have a mom that's like this, you sit down and have a 15-minute conversation with them. You know, is there a patient that's more important for you to see than the one that's in front of you at the time? My answer is no. That's the way I run my practice. You notice her main complaint right here is that her child basically slept through the vaccinations. Didn't have a problem with it. Now, did that mean that the shots put the baby to sleep? Not necessarily. All right. They didn't give them any, they don't give children sedation to give them vaccinations for the most part. At least I'm not aware of them doing it. But the thing that raises some concern to me is if the child seemed to have a neurologic change following the vaccination, that should have been investigated. It should have been taken a little bit more seriously. I think the way that they are presenting this is dramatic. I don't think that if that child was unresponsive, this particular mother would sit down and submissively let the child sleep for days and days and days without responding, without feeding, without moving its bowels, just laying in its crib. I think that that would have raised red flags for her. And if it didn't raise red flags for her, I would hope that it would have raised red flags for her husband.
That's what they told me. And I think it was almost 2 days before he really woke up. He had kind of woken up a little bit to nurse, but then he would go right back to sleep, but then he would wake up again, and then that's when he started vomiting. It was the next day. So he had the hypotonic reaction, the shock and collapse, and then the colic and the diarrhea and the vomiting started within 24 hours.
Now, perhaps I'm a little bit confused here. Are they saying that these symptoms were directly related to the vaccination? Are they also saying that rather than take the child to the emergency room, they sought the permission of the doctor to have the child evaluated further if they were this worried about the child? God forbid, I don't have my doctor's permission because my husband has a heart attack and I take him to the hospital after calling an ambulance. It just strikes me as strange that somebody that claims to be so attuned to their child's health would not have the ability to say, look, this isn't normal. I need to get it looked at. So I'm going to take the baby to the emergency room.
Did you speak to a doctor about that?
I did ask them. They said that it must have been a coincidence. He probably had a virus and that it would pass, and to give him Tylenol. So, yeah. They didn't tell us to come in. They didn't tell us to go to the ER or anything like that. Even when I was saying that he wouldn't wake up, they said that was no cause for concern. It was just normal.
So did you continue to vaccinate him?
We did. We vaccinated him again at 4 months. I again couldn't be in the room. They told us that they didn't have the combo shot, so they didn't want to give him the Hep B that day. So they gave him everything else except for the Hep B on his 4 months, and he had the same reaction, and it was worse that time. So that's when we woke up and we stopped vaccinating. Also because I think at this point I had mastitis probably 8 or 9 times, and then at his 4 months shots, when he passed out again and the vomiting and the diarrhea and everything got worse, he developed ptosis and strabismus, so the drooping eyelid and his eyes were not symmetrical anymore. And when he was born, he was perfect, face super symmetrical. He was cooing, he was doing everything just right on track. And then at 2 months, I think I didn't really notice like a major difference in his development, but at 4 months it was very obvious, and he stopped cooing and making noises, and his eyes really concerned me, but his diarrhea was just nonstop. So it seemed like he was always in pain. I had tried to adjust my diet because they said maybe he was allergic to my breast milk, and it was I was getting mastitis on the side that he would nurse from the most. He would vomit. I would nurse him again. He would vomit again. I would nurse him again. It was just this nonstop nightmare. And people had suggested to give him formula or to give him anything to help his stool that I don't know what those drops are for his stomach, but we tried everything. And nothing got better until I started taking these, found this Italian study, this brand of probiotics that helped mastitis in dairy cows. And so I tried it for myself and it worked.
Okay, I think that we're starting to see a recurrent theme here. First of all, the child seems to have something neurologically wrong with him. Whether there's a connection between the vaccinations and this neurologic issue hasn't been investigated, and there's no evidence been presented that there is a connection. You know, they're not proposing a mechanism or anything that would suggest a connection between the two. The other thing that we're seeing here is she has a completely unrelated condition called mastitis, which basically is an inflammation of the milk ducts. It's very common with nursing mothers. Now, she's associating that with the child's illness. And notice that rather than go to the doctor about that and get the warm compresses and possibly even antibiotics, which is the standard treatment for that, she instead goes to YouTube and looks at an Italian veterinarian study and decides to experiment on herself. Look at the level of reasoning that's going on here. This is a woman that obviously mistrusts medicine and trusts her own ability to do research, quote unquote, on YouTube to handle her own health issues. This is a common theme that I see.
So I finally got rid of my mastitis, and then I thought, well, maybe there's something to this natural stuff, this holistic stuff. So that's when I started looking into.
Did you vaccinate your son again after that? Was that the last
that
vaccine?
was it.
You were done.
That was it. We did go back to the pediatrician, and we had a conversation with him at a checkup. We said we weren't comfortable vaccinating him during that visit because he was sick. And I was asking him a bunch of questions like, why does he need this many? What are the diseases you're vaccinating against? And he told me not to worry, that walking down the street, this is literally what he told me, walking down the street exposes you to more antigens than is in any vaccine that you're going to get. So my son's like,
I hate these bloody doctors. What's his name?
Well, once again, what we're dealing with here is a bad relationship between the patient and the doctor. Now, is that all the doctor's fault? I think by listening to this lady, I would say that there's probably a little part of the problem is being contributed by the mother here. She is very hostile to medicine. She is quite confrontational, it seems. Now, there's a difference between asking questions about vaccinations and listening to the answers from the expert versus arguing with them and ignoring them, instead choosing to do your own internet research on YouTube to cure your son of his neurologic issues, cure your mastitis with a proposed veterinarian cure based on macrobiotics of some sort that she's going to eat. She's not understanding or buying into the idea that, look, you've got an expert right here that's available to answer your questions. Listen to them.
Can I say his name?
Yeah.
Really?
I'll
Okay.
take responsibility.
No, you really can't, because I'm not going to have that on my channel. I'm sorry.
And then after that, he kicked us out of his
Hey,
practice.
should nobody go to doctor? He should not be around babies.
He told me after
It's
that,
disgusting.
if I'm not comfortable with his knowledge or whatever, that it's best that we seek another pediatrician.
If you're exposed to more antigens walking down the street than you are a vaccine, then what's the point of getting the vaccine at all in the first place?
Right? That's why I was happy
logic
to
is
leave
ridiculous.
his practice.
Well, the reason is that hopefully you're not being exposed to pertussis walking down the street or measles. Granted, you're going to come in contact with cold viruses and things like that, and there's such a tiny amount of these in vaccinations that, yes, the overall quantity of antigens that you're exposed to walking down the street is probably higher. But they're not tetanus. Come on.
He actually helped wake me up with that comment because it was so bizarre. So just
moron.
so
Oh, we've got
Yeah.
to start exposing. Somebody, one of the peeps has got to start making a list of all these doctors that has ruined our children because they should not be able... We've got to take control, right, this year?
yeah.
So we're telling people,
Right.
do not vaccinate, and we're
Right.
going to name and shame every single doctor that's hurt our child.
Right. Right. And also when I called their office, the office that was responsible for injuring him, they dismissed my concerns. They didn't even suggest like bringing him in. They didn't recommend taking him to an ER. Nothing. Just complete neglect. Like the worst care possible. So that's, yeah, we totally stopped after that. And then my son continued to suffer from his injuries for, 5 or 6 years. He didn't have a solid bowel movement until he was 6 years old. He didn't stop wearing diapers until he was 6 on his 6th birthday.
You know, did it occur to you to take the child to a gastroenterologist during that time? You understand that having to wear diapers until age 6 is not normal. If you're having this much of a problem, did you seek the advice of an expert in gastrointestinal diseases? Did you go to the emergency room? What's the rest of the story here? There's got to be more of a story here. And then I don't understand how you're relating gastrointestinal problems to a vaccination. Because as we recall from the last episode, there's a table of conditions that are associated with each vaccine that a child gets. Is this on that table? Have you checked?
I had started looking into ways to help his intestines. And I remember coming across the Wakefield study and everything, and I looked into what types of ingredients are in the vaccines that could have been responsible, and I found that the cell cultures that they use are epithelial cells, and there's only 4 types of tissue in the body. There's the nervous tissue, connective tissue, epithelial tissue, and there's one more. But so the epithelial cells are responsible for all the barriers, like the skin barrier, and kids are getting eczema after vaccines, right? The intestinal barrier, and after vaccines, all the kids are getting the gut dysbiosis, the chronic diarrhea, and then the lung barrier, and all these kids are getting asthma, and the blood-brain barrier, and all these kids are having neurological problems.
Boy, there's a lot to unpack there. First of all kids don't get these things. They're extraordinarily rare. Now, out of 4 billion vaccines that have been administered between 2006 and 2017, we had 780 vaccine-related complications that were compensated through the Vaccine Injury Court. Go ahead and have a look at the video I did on the Vaccine Injury Court. So it's extraordinarily rare. If you look at the rate of vaccine-related complications, not injuries to the shoulder and the arm, which are 80% of the injuries, just the vaccine injuries due to complications of the vaccine, it's approximately 1 in 5 million doses of vaccine. The other thing is they mentioned Dr. Andrew Wakefield's study. Now, we're going to talk about Dr. Andrew Wakefield next Wednesday. But the bottom line on his study is it was initially published in Lancet, which is the British Medical Journal. And he reported this trend amongst 12 children that suggested a connection between the MMR vaccine, not the individual measles vaccine that he was trying to patent, but the MMR for measles, mumps, and rubella, somehow initiated Crohn's disease in children, and that Crohn's disease then somehow initiated autism. When it came to light that he had not only falsified his data, there were consent issues with these children and medical ethics issues. And as it turns out, he was trying to patent an individual measles vaccination to replace the MMR. And had his study been accepted, he would have been a multi-gillionaire because he had the patent on the individual measles vaccination.
So I started looking into ways to treat the barrier proteins, healing the epithelial tissues and the epithelial cells. And I came across so many different methods. This one Chinese herb that I found contains this component berberine, and this is just an herb. There's a million companies that sell this thing over the counter, and this is one of the methods that I use to heal my son. It repairs the myelin sheath and neurons. It heals leaky gut. So I went through every single treatment that I could possibly find, and all of the people who had shared their story about vaccine injury, and I read every study ever done from any doctor that has worked with people with Alzheimer's, autism, Parkinson's, Fragile X, because they all share the same beta amyloid proteins. But before that, we had been prepared for sending him to the regional center told us not to worry. This is when he was 2 years old. Don't worry, we have really great public programs. When he's older, he can live in a group home. He could possibly get a job washing cars or bagging groceries, or if anything, like, we can help you find people to set things up so that he will have care for life. Like, if he needs to be in diapers his whole life, you can't take care of him, we'll find someone to take care of him and you'll be fine. And so we thought that this was just going to be our lot in life. I didn't set out trying to recover him. I set out trying to just help his gut, just to heal his leaky gut, because everything just went right through him. And we got him into a special needs preschool where he was for 2 years for children with severe autism. So the first year of preschool, he was in the class with severe autism. And then the second year, he was in the class with children with moderate to mild autism. And then each year he just kept getting better and better. And then now we're at the point where the school district thinks that he was just misdiagnosed. And a lot of my family members too, people had like totally discounted the injury and everything, saying that it was just an accident that he got diagnosed. But he also has severe allergy to antibiotics, and no one told me that there are antibiotics and vaccines. Mm-hmm. He also got Epstein-Barr virus from me in utero, and no one told me that Epstein-Barr virus can activate a retrovirus called HERV K18, so human endogenous retrovirus K18, which can cause sepsis, immediate sepsis, if the immune system is triggered by anything.
You know, this is an exaggeration, very much like her claim that because she has spina bifida occulta, you know, she's pretty much guaranteed to have a spinal cord injury if she has an epidural, and therefore she's afraid of going into the hospital because they may threaten and scare her into getting an epidural. I did a little bit of research into this. It's not anything at all like she's claiming it is. It's actually kind of sad that she's putting it out like that. But in any event, again, we don't have a formal diagnosis on this child. What's going on with the child? Does the child have autism? Children get autism. It's not related to vaccinations. It's just coincidental that they're diagnosed with autism about the same time they're getting their baby shots. That's the age group in vaccinated and unvaccinated children in which autism starts to rear its head. Now, I had a son that had some autism spectrum problems, and that is approximately the time that he started developing them. He started lining up his cars and he stopped talking for a while. Now, he's recovered from that because he was very mild and is successful as an adult now. But they're trying to make this connection based on Wakefield's work between these vaccinations and the fact that they had a bad outcome with autism in their child. The two are completely unrelated.
Vaccine or bacterial infection or anything. So I think that his hypotonic reaction happened because he either had a reaction, a huge immune response from the vaccines, from the adjuvants in the vaccines, affecting either the Epstein-Barr, or if he has this retrovirus, or he developed an autoimmune condition to the epithelial cell proteins in the vaccines. Like there's a group of proteins called claudin proteins, and they're responsible for the
You know, before she goes on too far into all of this research that she's doing, does she have any citations from medical journals, peer-reviewed medical journals where they've studied this? Or is this all just stuff that she's come up with on her own by watching YouTube videos? I suspect the latter.
For the barriers, and when they make the vaccines, they denature the cells. You know, they have the cell culture, they infect it with the virus, they denature it. It doesn't dissolve the cell. It just breaks up the proteins. Then they take the whole goop, they spin around in a centrifuge, and they separate it by molecular weight. So the molecular weight of a virus, it has the same molecular weight as the DNA of a human, or as the certain proteins of a human. And then when you bind those proteins to aluminum or polysorbate, the body recognizes the human proteins as an adjuvant and makes antibodies against that. So that's how the autoimmunity works. And that's, I think his condition was like just this full autoimmune condition, but no doctor would test for any epithelial cell protein antibodies.
I'm pretty sure.
Well, I think the reason for that is because that's nonsense. Okay, first of all, an autoimmune disease is when you develop antibodies to your own body. What you're developing when you get vaccinations is immunity to the bacterial or the viral antigens that are in the vaccine. So when your body sees that virus or bacteria again, it already has all the machinery in place to kick out antibodies to kill it. That's not an autoimmune disease. Rheumatoid arthritis is an autoimmune disease. Lupus is an autoimmune disease. Vaccination gives you immunity. That's a difference.
No, the information you know, that's for sure.
Well, I'm hoping that someone will now and look into it. It is out there.
You actually explain it really, really well, like a good teacher.
Oh, thank you.
Now, even though that was complete and utter nonsense, notice how they're reinforcing it with her, you know, you're good because you're woke.
So your boy is doing fine now.
Now he's fine.
But the absolute beauty of this story is that you went on to have another baby.
Right. Yeah, I went on to have another baby on
Same
accident.
dad.
Same dad, but after that, we decided that we were done. I really regret that because we were scared. At that point, this is before I healed my son. I didn't know if it was genetic or if it was even the vaccines, but maybe some other environmental trigger. So we chose to not have any more kids. And I mean, that's how, if this is a depopulation thing, you know, they got me because I was done having kids.
You know, when parents have a child with medical or mental issues, one of the first things that they do is they tend to blame themselves. They try to figure out what they did that caused this. And then after a period of time of self-pity with this, then they start thinking that, well, no, it couldn't have been my fault. It was the fault of something else. And then they go looking for something else to blame it on. And one of the things that we see in the anti-vax movement a lot is they like to tend to blame it on the vaccines, completely unrelated things. Another factor in personal beliefs and the 4 reasons that people are vaccine hesitant.
But we want to hear about your daughter.
Yes,
because
my
does
daughter.
she have all the same conditions as she's had no vaccines at all, no vitamin K, nothing.
Nothing.
Did you give birth at home again?
Yes.
Gosh.
And she's a mermaid baby. She was born under the water, so I tell her she's
so
half
nothing
mermaid.
at all, no goopy stuff in the eye, nothing.
No.
All right.
No.
So now here's the thing.
Mm-hmm.
Your vaxxed unvaxxed study.
Yes.
Does your daughter have any of the same symptoms as your son?
0. She has nothing. She had no issues with anything health-wise. Whenever our house would encounter an illness, my son would get sick first. He would get sick the longest. I would get sick second, and I would get sick maybe half as long as him. My husband never gets sick. Never. And my daughter also never gets sick. I think a few times she got sick, but she would get over it in like a day.
Did she have ear infections?
Yeah, she did have like 1 or 2 ear infections, and that's how we found out she's also allergic to antibiotics.
Okay, so this one-on-one vaccine-free study that they have could also be looked at as you have a disabled child. The rest of your children aren't disabled. When I was in residency, I reviewed an article once that related serum cholesterol level to death by automobile accident. These are kind of whimsical articles because it shows that when you data mine enough, you can make your data show things that aren't there. Now, what we're looking at here is we're looking at a family that has a disabled child. Now, the fact that their other children are not disabled doesn't mean that there's a correlation between something that happened to the disabled child versus something that didn't happen to the non-disabled child. There's no correlation with vaccinations here. There's no more correlation with vaccinations than there are on the day of the week the children were born. But unless you can show me the mechanism by which they were disabled and show how a vaccination influenced that mechanism, I don't think that you have much of a case here. Did you take this to the vaccine injury court? Was it on the table? Did you take it to civil court if it was not a covered vaccination or a covered side effect? Did you get an actual diagnosis on this child? Did you take them to specialists that scope them or behavioral health specialists? These are questions that are unanswered in this video. But let's go ahead and continue to listen.
But you gave her antibiotics.
Right, because we went to.
Interesting.
I know this was still when I was thinking. You know, I think I was just so beaten down with watching my son day in day out. Like, oh my, how many times did I call his name and like do anything bizarre to try to get his attention, to have him look at me? And I was just over it. I just thought, okay, kids are sick, fine. I'm just gonna bite the bullet and do antibiotics. But even so, my daughter having antibiotics and then having a reaction, and we stop them, right? She has a reaction to antibiotics. Oh, let's stop it. The reaction to vaccines, no, continue. So, but she's She's so on fire mentally.
But she doesn't have
She
autism,
has-
seizures,
does not have
eczema, allergies.
no gut issues, no skin issues, no allergies, no food sensitivities, no noise sensitivity, no light sensitivity. I mean, my son, I couldn't sing a lullaby to him probably until like last year, until he was like 6.
You know, the sensitivity to noise and lullabies is pretty common in autism. It's one of the symptoms of autism, in fact.
It was just really, he couldn't even be soothed. You know, I couldn't comfort him. I couldn't connect to him. I couldn't comfort him. I couldn't, yeah.
All because of vaccines.
Oh, yeah.
Now, you see how they're relating all of these symptoms to the vaccine? That's the interviewer prompting her because they want to get that soundbite.
And recovering him, I specifically looked for information on each adjuvant. So it's not like I gave him something that was just like a general cure-all thing. I looked for things like how to detox this specific thing from the body that is included in vaccines. And then once we cleared out his body and then we repaired the cells, he started doing better. And I repeated the process. Just clean out the body. This one Alzheimer's treatment I used was this enzyme from the stomach of earthworms. It's called umbrocanase. It dissolves fibrin deposits, the plaques in the brain, and it'll dissolve biofilm from any infection. So Lyme disease, bacteria, viruses, parasites, you name it, mycoplasma, it'll get rid of the biofilm. So you can clean out the gut, and then you can also, it gets rid of some of the metals because the biofilm from these infections, they anchor themselves on with these metals, and you have to get it out of the body. So as much as you want to like do certain treatments, if the metals or if the ingredients or the adjuvants or whatever is still inside of the body, it's always going to reappear in some form, and so I went through the stuff that they've done on the autism, Alzheimer's link, Professor Chris Exley, his work with aluminum.
Mm-hmm.
Yeah, I've read every single one of his papers and followed his work very closely, and I used all of his recommendations with the silica water and everything. So
do you think silica water works?
It's legit. Like the soil in the earth
Mm-hmm.
has a super high aluminum content, but the way it is naturally, it's bound to silica. So the Industrial Revolution, everything, we separated the aluminum from the silica with these chemical reactions. So we made this unnatural aluminum. And when you put high amounts of silica in the body, it just binds back to it and makes it inert. So
where'd you get a good one?
Okay, so he recommends like Fiji water and the high silica water, which we use nonstop,
Mm-hmm.
but also I use horsetail herb, bamboo extract, BioSil.
Okay, you got to write a book.
Okay.
You have to. There's someone else is saying it here as well.
Okay.
Funny enough, whoever said you got to write a book, we'd already talked about that before we even heard the story, didn't we? Was you, wasn't it?
Oh, I need help. I need someone
Yeah.
to volunteer to help me write a book.
Yeah, you do, because it's important. We don't have enough on how people have recovered,
Yeah.
and you really have a good way of explaining things that doesn't bore people. You know, you go on and on and on.
Thank you. And this is very late at night for you, so
No, I mean,
you're not
it's
bored.
good. It's interesting and it's easy to understand, and that's what everybody needs.
Okay.
So
I would love to.
Kind of a little stroke to the ego there. So far, a lot of what she's put out has been basically word salad come off of YouTube and natural health sites. Again, what is the diagnosis of her child? What do the specialists in healthcare say about the diagnosis of her child? What treatments are they recommending given the diagnosis of her child?
yeah, They love you. I mean, it's late, but they love you. So, you want to write a book? What else do you want to say?
What else do I want? Jeez.
What I want to take your number as well, because we do want to make some movies about recovering children as well, rather than all this vaccine injury. We're going to make some more vaccine stories, peeps, and if they don't get it by then they're on their own. What else can we do? I mean, there's enough. It's like Dr. Suzanne Humphrey says, what more do I have to do? I've done a video on everything.
Yeah.
There's nothing else to do. If you don't get it now, then you're never going to get it.
Right.
You know, I'm in absolute agreement with this statement. How much evidence do we need to put out? How many videos do we need to make to show that vaccines are safe and effective? Let's have a look at the cases of polio worldwide. The vaccine came out in 1955. Look at how the cases plummeted. Same thing here with measles. You can see where the vaccine was licensed. Look at the number of measles cases. Recall that in 1960, 48,000 people were hospitalized due to complications of measles in the United States, and we had over 400 deaths. Smallpox doesn't even exist except in research labs in Atlanta and Russia. Now, the person that they mentioned in this particular segment is Dr. Suzanne Humphreys. Along with Dr. Andrew Wakefield, this lady has killed people. There were 83 deaths due to measles in Samoa just last month because of vaccine hesitancy by people that are quoting this Dr. Suzanne Humphreys. She'll have her turn too.
Right? They'll learn the hard way like I did, right? That's the only chance left for them. But what I really want to say is, like, yes, I have a story, and I really want to make it a story of hope. Like, it's 2020. My New Year's resolution was not just defeating the mandates, but putting so much hope out there for everyone who is suffering, that there's a way out, and we can all work together and you know, make these things known. And I'm happy to share every part of my story.
Oh, good.
Well, good. Why don't you start by sharing what your child's diagnosis is? Start by sharing whether or not you went to the vaccine court to see whether or not this was somehow related to your vaccinations. There's a couple of things that I really want to go over here real quick, and I think that they're kind of important. So let's go ahead. This interview is pretty well over. Let's go ahead and have a look at a couple of things. One of the things that they like talking about is something called the Nuremberg Code. Now, the Nuremberg Code talks about medical experimentation and consent. Now, you can find the Nuremberg Code in Wikipedia, and the important part is right down here. These are the 10 points of the Nuremberg Code. Now, anti-vaxxers classically use this to say that you can't force vaccinations for children to go to school. But let's go ahead and have a look at it in the context of this interview. The first and foremost of these requirements is that the voluntary consent of the human subject is absolutely essential. Can a disabled minor child with severe autism give consent? That's one question. The second question is, the experiment should be so designed and based on the results of animal experimentation and knowledge of the natural history of the disease or other problem under study that the anticipated results will justify the performance of the experiment. We don't know exactly what causes autism. And to have this young lady experiment on her child using things that she read about on the internet raises some questions here. Number 8 is also very important. The experiment should only be conducted by scientifically qualified persons. Is this mother a researcher, a formally trained researcher? Or is she just trying things that she found in desperation on the internet? Number 9, can the human subject of this experiment say, I don't want to do this anymore? Can he tell his mother that he doesn't want to ingest Fuji water or sand or worm eggs or whatever it is that she's giving him? And on number 10, is this mother prepared to stop the experiment? Or does she believe in it so much that she will continue it regardless of whether or not it's bearing fruit? So those are some serious questions. Now, since the Nuremberg Code came out, we have the Declaration of Helsinki as well, and that has an interesting thing about consent that I want to share with you. Again, this is on Wikipedia. You can find this pretty easily. But under basic principles, right here, the recognition of the increased vulnerability of individuals and groups calls for special vigilance. It is recognized that when the research participant is incompetent, physically or mentally incapable of giving consent, or is a minor, then allowances should be made for a surrogate consent acting in the subject's best interest, although their consent should still be obtained if at all possible. Now, here's the problem that I have with this one. If the mother is the primary investigator and it's the mother that's giving consent to have her child investigated, is there not a conflict of interest or an ethical problem there? Here's how I see this. We have a mother that is very suspicious of the medical profession. She is in a situation where she's under a great deal of stress. She has an autistic child, and she's looking for somebody to blame, or somebody or something to blame for it. Because she's not getting good results from her doctors, or she's perhaps not seeking the advice of her doctors, she is more interested in relying on her own research abilities on the internet to try and find answers to this problem. She has indicated that she believes in other conspiracy theories, such as the vaccines are used as a method of population control. Now, this is a classic case of these people from the VaxxTV movie going out and trying to infiltrate vulnerable individuals in communities, such as they did with the Somalis in Minnesota or the Orthodox Jews in New York and New Jersey, and try and promote this anti-vax agenda that they have and this narrative. They're looking for people to self-report to their RV and tell a story such as this mother's doing. Now, we have to recall that all of this stems from Dr. Andrew Wakefield. Dr. Wakefield falsified data in a study that he got published in Lancet. This study was designed to show a link between the MMR vaccine, Crohn's disease, and autism in a small sample of 12 children. He did not disclose the fact that while he was attacking the MMR vaccine, he was busily developing a measles alone vaccine to replace it, which would have resulted in significant financial gain for him. Due to this and other unethical activity, Dr. Wakefield lost his license. So in closing, thank you for stopping by. I am going to be looking at more of these interviews in the future. I'm going to continue my series on the anti-vax movement. Next week, we are going to outline specifically the sins of Dr. Andrew Wakefield and the debunked connection between the MMR vaccine and autism. So, signing out from Northern Michigan, this is Bob the Science Guy. Thank you for stopping by. If you like this format, where we have a recorded presentation with me in the comments, make a note of it down in the comments. Make sure you like and subscribe, and we'll see you again soon. Take care.